So that is what Hippo. All right. So then let us see the introduction to the Hippocratic Oath. So Hippocratic Oath is an oath historically taken by physicians and other healthcare professionals swearing to practice medicine honestly. So we need to practice our medicine honestly uh, in our profession. So it is widely believed that Hippocrates written this oath. So the actual Hippocrates oath is more Greek in terminology. So he derived the oath from Greek. Uh, how can I say, from Greek knowledge. So we have recently we modernized the Hippocratic Oath. So currently we are following the modern version of the Hippocratic Oath. So let us see what is the motto of. So let us see the motto of Hippocrates Oath. So the motto of Hippocrates Oath is first, do not harm the patient. So the first one is I swear to fulfill to the best of my ability and judgment this convenient. So this convenient means at this situation. So we always must try our level best in our capabilities to help the patient. Then second motto or second oath is I will respect the patient hard-won scientific gains of the physicians. So simply we need to respect our teachers. So we need to respect our teachers because they are the one who taught us the medicine, and we need to share this medicine to the future generation. We need to share the knowledge of the medicine to the future generation. So that is the second oath. So the second oath tells that we need to respect our teachers because they have given us the knowledge, the medical knowledge, and it is our responsibility to share the acquired medical knowledge to our next generation, to our future generations. So that is the second oath. And third oath is we always try to see whatever we are doing will be benefit to the sick. So whether we need to know whether the patient getting benefit out of our treatment or not. So unnecessary treatment must be avoided. So always we need to keep the patient in mind. Then we should try to comfort the patient. We should try to always show love and empathy towards the patient. More than a surgeon's knife or a chemist drug, the love towards the patient heals the pain or heals the suffer. So we always need to comfort the patient and we need to show empathy and love towards the patient. Then the fourth oath is when we don't know something. So a patient came and we don't know what exactly the reason of the patient disease. At that time, we should not feel shame. If you don't know something, you can ask your colleague and you can know what is the case. So it is good to take advices from our colleagues or from the senior medical practitioners. So we should not feel shame to asking or to say, I don't know this thing. It is all right because everyone don't know everything. So we all have some loopholes and we need to accept that we don't know something and we need to get clarified from our fellow physicians. So that is the fourth oath. Then fifth oath is very dedicated to the privacy and confidentiality of patient information. So privacy and confidentiality plays a very important role in medical care. So because there are many socialized stigma around these diseases. So in the previous days, they used to think that diseases occurs due to some sin. Only the sin people will get disease. Only the one who did bad things will get disease. They used to feel that disease occurs to a bad person. God is punishing the bad person with a disease. So that is what they used to say. So so that is why when the patient got a disease, they themselves will feel that the society view on them. So because society will see as they done something wrong. So that ignorance by the society itself make them too much suffering rather than the actual disease. The view of the society on them will make them more suffering. So that is why always we need to maintain confidentiality in patients diseases. We should not tell his problem to anyone. because people will start blaming the person. Sometimes this will happen, especially for HIV patients. See, HIV doesn't mean always getting through sexual intercourse. So HIV will also occur due to horizontal transfer, such as through needles or through having blood transfusion with a contaminated blood, or there are many other several factors that will result in getting HIV infection. But whenever we say someone has HIV, immediately we will think, oh, he's a bad person. Actually, he haven't done anything, but he acquired by some other means. So always we need to maintain the confidentiality of the patient data, or whatever patient things that we came to know. We need to maintain utmost secrecy. We should not share this thing to anyone, because when we are sharing with someone, they will start blaming him, or it even may cause some financial burden to the patient. Maybe their family will leave the patient alone. So we always need to maintain privacy of the patient, and we need to respect the privacy, and we need to maintain confidentiality. That is the fifth oath of Hippocratic. Then, the sixth oath of Hippocrates is, I will remember that I do not treat a fever arm. Really interesting. If you read this paragraph, it is like we should not treat if the patient is too sick. So what is this statement? Why we should not treat to a patient who is very sick or advanced stage of disease? Because if we already know that the patient gonna expire no matter whatever we are trying to do, at this condition we need not to treat the patient, because already patient is in coma, and we know that patient won't we cannot bring back the patient who is from coma, right? If we are pretending like we are treating the patient even though we know that we are unable to recover the patient, then we are hurting their family members. Actually, we are making the family the burden of the family, uh, majorly with financial matters, because we are making them to pay more for the patient who cannot be bring back to healthy condition. So we also need to think about the family situation. We also think about who is living currently with him. Accordingly, we need to go for the treatment. If we know that the patient, we cannot recover the patient anymore, we need to tell this fact to the family members. He is severely injured, and it is really tough to bring back the patient. So there is only 10% chances of bringing him alive, and this 10% will cost you around some 10 lakhs. Will you proceed? Will we need to tell the family, will I need to proceed for this or not? Because we know that he may not alive. So at this situation, why should keep financial burden on their family? So we need to think about the patient's family also. And also, uh, prevention is better than cure. So rather than getting some disease and cured by the disease, then cure from the doctor, it is always better to prevent the disease in the first place. So always we need to try to prevent the disease to the patient before he even acquiring it. So I will try to prevent the disease whenever I can. For the prevention is preferable to cure. So the best strategy is, we know that malaria will get by mosquitoes, and we know that mosquitoes will lay eggs in the water. So if we know that certain people will uh, there is a likelihood of getting malaria infection to certain people because of this dirty water, we need to tell them, not after getting malaria we should not treat the patient. Rather than, we should take precautionary measures to prevent the malaria in the first place. So we need to advise them to not to store stagnant water. To then we need to chlorinate the water which is in the storage water need to be stagnated. Sorry, storage water need to be chlorinated. So we need to take preventive measures, so the people won't even catch the malaria. So that is the seventh statement of Hippocrates oath. So sometimes If we feel burden on our medical practice, if we are really feeling burden on doing your regular medical professional practice, then you can leave the job. You can enjoy your life with other domains. You can have arts, you can choose arts, or you can take another profession, whatever you want. But never try to treat someone without interest. If you are not interested, you can move on to another profession, but always show empathy and respect towards earlier profession. So that is what the importance is. If you can't do medical practice, better enjoy other domains, but never try to uh, force yourself to treat someone, or never try to pretend that you know everything. If you don't want, you can live happily. So that is also one important aspect of medical practice, right? So this is the overall statement of Hippocrates oath. So I will give you a brief summary of Hippocrates oath. So this is a brief summary of Hippocrates oath. So we need to respect our teachers. We need to take pledge that that our life to the service of ours, to the service of others. So we always need to dedicate our entire life for the service of patients, and also place your patient's interest before your own. So our patients' needs should be our first priority rather than our priority. Then protect your patients from harm and injustice. Whenever possible, we need to protect our patient from any harm and injustice. Any harm means, um, if there is any chance of okay, the patient is in ICU, then if someone trying to, he may have some quarrels before. So if someone trying to poison him, we need to prevent that poison, that attack. Or if someone trying that they won't give money to save the patient, still we need to try to save the patient. So if there is any injustice happening to any patient, means we need to protect our patients. Then we need to treat all our patients equally. We need to respect patients' right to make decisions. We need to continue to improve care for the patient. Do not become intimate with patients. This is also one important thing. Never try to become too much emotionally attached to the patient. Okay, because if you become too much emotional to the patient, you may give false treatment to the patient, because patient may say, sir, I'm feeling pain on injection, please don't give injection. And if you start emotionally attached to the patient, you will think, okay, why should I hurt the patient by injection? So you will neglect giving injection and you will go with other procedures, and that may harm the patient. So it is always advisable to not to be too much emotionally attached to the patient. So do not become intimate with patients. Try to prevent as well as cure disease. So not only curing the disease to the patient, we also must take measures to prevent this disease in the near future to the patient. So as we say, prevention is better than cure. So always we need to try to prevent the disease in the first place to the patient. Then we need to protect patients' confidentiality, and also whatever knowledge we require, that knowledge should be impacted to the future generation. Simply, we need to share the acquired medical knowledge by our teachers. So this is the complete summary of Hippocrates oath. So from here onwards, you must follow this Hippocratic oath when you are doing your medical profession, especially in the diagnostic field. So this is all about Hippocratic oath, students. So the next topic in this subject in today's lecture will be confidentiality. So the role of confidentiality in medical ethics. So let us discuss about confidentiality in medical ethics. Before discussion about medical ethics, especially the confidentiality, let us see a short video on role of confidentiality. So kindly watch this video, students. So you will get some idea.
Confidentiality is a key component of the patient-physician relationship. Patients who believe that their health information will remain confidential are more likely to provide doctors with more accurate information which in turn will lead to better medical advice. Here are 3 things you cannot forget about confidentiality. 1. Most breaches are inadvertent. You may encounter a particularly challenging case that you want to share with your colleagues. That is okay, as long as you don't disclose information that can reasonably lead to the identity of the patient, like name, initials, prominent family members, or occupation if unusual. You should also refrain from sharing cases on social media, especially those who might be on the news, as you can easily lose control of who sees this information once posted. 2. Confidentiality applies to individuals, not families. It is not uncommon for physicians to care for multiple family members. This can be very rewarding, but also fraught with ethical dilemmas. What if your patient asked you why you prescribed birth control pills to her 15-year-old daughter? Or what if you received a request from an insurance company for your patient's family history after you recently diagnosed his father with coronary artery disease? With few exceptions, you can only disclose medical information with your patient's implied or express consent, and the information disclosed should have been collected directly from that patient. 3. There are exceptions to confidentiality. The law recognizes specific situations where you need to disclose information for the greater public good. An example of mandatory reporting is when you suspect that a child is in need of protection. There are also situations where it is permissible for a physician to report to a governmental agency. For instance, in the situation in which a patient demonstrates to you that he or she will likely inflict serious harm on a specific person or group of persons.
Yes, ma'am. Just wait. Good morning. I'm in class. Yes, ma'am. It's okay, ma'am. Okay, students, just wait. So, all right. So, now you got some idea about confidentiality, right? So, let us proceed.
Confidential.
So, what does the duty of confidentiality require? So, confidentiality is one of the core and fundamental tenets at medical practice. It requires healthcare providers to maintain a patient's personal information and private. See, students, keep in mind we got a celebrity to the patient as a patient. Obviously everyone will get some diseases. So for example, a very well known celebrity came to our hospital and he has some problem. Will you immediately talk each other? Will you immediately post something on the media, in your Facebook or in your WhatsApp status? Oh, so and so person, maybe Shahrukh Khan came to my hospital and he has a kidney problem. If you tell these things, definitely that will make a major problem to their career. So we always need to maintain confidentiality, but there are few breach and there are few exceptions where we can share patient personal information. For example, if a patient has HIV positive, we came to know that the patient has HIV, and at this time what we can do is this person may transmit HIV in the community. So first we need to give counseling to the patient through an appropriate channel. So we can discuss this information with the counseling department of the hospital. So the department will take care of the patient. They will call the patient and they will tell what happened to the patient. They will say they will take care of patient emotional stabilities. Okay, and also if the patient and also we can share this information by any law. So is the situation demanding us to share the patient information, then we should share that with an appropriate channel. Okay, so there are few breaches and there are few exceptions where we can share with certain. So the core of confidentiality is based on respect the patient's privacy. So the patient expect the doctors to maintain confidentiality. We need to maintain so confidentially promotes trust in the physician patient relationship. Confidentiality heartens patients to seek medical attention. Confidentiality encourages patients to share information that can be improvement for the for the decision on the treatment. And also confidentiality will prevent harmful consequences to the patients. So that is why we need to maintain confidentiality. So what type of information is confidential? So all identifiable information will be confidential, such as patient name, age, sex, his address, his profession. So all these things must be kept confidential. So the all identifiable patient information must keep confidential. It can be either written, computerized, visualized, or even audio recorded. Subjects need to be keep confidential. So it can be either written form, computerized form, visual form, or audio form. No matter in whatever form it is, we need to maintain secrecy of the patient details. So that is what confidentiality. So any clinical information about individual diagnosis or treatment must be keep confidential. That means if the person has any hepatitis, we should not tell information to anyone. A photograph, video, audio tape of or images must keep confidential. Sometimes during surgery, we must take video of the patient, and that video should not be shared with anyone. We may take some photographs of the patient, and those photographs should not reveal to the society. In case of psychopathics, that means in case of mental patients or the person who has some neurological problems, at that time we can record his behavior, we can record his audio, okay, and such audio tapes also we need to keep secret. And also who's the patient doctors and what clinic patient attends also need to be keep confidential. That means which doctor treating so and so person, and what clinic so and so person going for his treatment. All those things must keep confidential. And shared information at conferences. Sometimes we may we may take some clinical case studies, and we will start discussing about these clinical case studies in the conferences for a better treatment. For example, we will say we may need to discuss about a pregnant woman came and she have seven-headed baby. So at that time, we can discuss about the seven-head baby case, but at the same time, we should not discuss about any patient identifying parameters, such as what woman is she, from which village she came, or what is her name, what is her address. We should not tell all those things. And also, all facts that has been found out during consultation and investigations. When we are investigating patients, they will tell many things. So and so went there and how I got the problem. So whatever they are sharing with us, we should not unveil these things to anyone outside the public. So these things we need to maintain confidential. So what does the duty of confidentiality require? So nowadays the major problem that we are encountering is everything is computerized. All patient details are computerized, and there is a high chance of hacking this computer data, or there is a high chance of leaking this computerized data. So we always need to keep a stringent firewalls on the softwares that are handling the patient data. So that is why a bill has been passed. So this bill is called as Health Information Portability and Accountability Act. So according to this act, if you share your patient details to anyone outside the public, you are legally punished for 5 years in the jail. So we always need to keep confidential about the patient details. So instructions are required to have policies to protect privacy of patients' electronic information, including processes for computer access and security. So we must maintain a high level of confidentiality of patient details. And there is a dedicated law for protecting patients' private information. If you unveil this information, you will be subjected to. So violations. So violations of confidentiality means breaches. So sometimes we may need to share patient information to someone. So these breaches can be categorized into three levels: 0 level, 1, 2, and third level. So there are three levels of breaching of confidentiality. So let us see 0. 0 level means no breach of confidentiality. So between the members of medical team or required by law. So usually what happens is, in case of 0, there won't be any breach of confidentiality. That means the patient secret information uh, won't be accessed by anyone. Rather than the information will stay within the medical team or required by the law. Required by the law means sometimes we need to pass this information to another hospital. So this is a 0 breach confidentiality. Then level 1 breach confidentiality. So level 1 breach means trivial breaches of confidentiality. That means if you are sharing patient information with the third person, that means I came to know so and so person has some problem and I discussed that person. So without that patient name, I will discuss. There is a patient came to my lab, and that patient has this problem. So we a problem. So that is level 1 breach. Then level 2 breach means here I will tell about patient name also. I will tell so and so came to my hospital. So his name is X, and this is a medical professional. That means to a normal person, I will start discussing of report, patient details, everything. So that is level 2 breach of confidentiality. And third level breach of confidentiality, someone who is unknown. So that is a severe breach of confidentiality. That means complete patient information has been shared with a non-medical professional. So that is called level 3 breach of confidentiality. So we need to ensure that we are always maintaining the confidentiality of patient information, and there sometimes we may breach the confidentiality, and those breaches can be categorized into these 4 levels: 0 level, first level, level 2, and level 3 confidentiality. So when can confidentiality can be breached? So overriding concerns can lead to need to breach. Okay, sometimes we need to share patient's information. So at what circumstances we need to share the patient information? So uh, so there are few exceptions. Let us see exception 1. So concern for the safety of other specific persons. For example, if the patient has any suicidal, the has any schizophrenia, or he's suffering with some psychological abnormal state, we can discuss about patient information with his family. So patient has any infectious disease, at this situations we can share this information with tuberculosis. Then we can share the patient details to the RNTPC department. So RNTPC means it is a dedicated department for taking. Second exception is if the law demanding us to give the patient details. For example, there is some sexual abuse. Police asking us regarding the woman's details, and they're asking some private information that is necessary to investigate the issue. So at this time, we can share the information. So what if a family about the patient? See, If a family member asking regarding the status of the patient without getting permission from the patient, we should not discuss any information. For example, this is a routine problem we will encounter in the hospital. They will say whether my husband has a heart disease, or whether my husband has diabetes, or whether my husband has any problem. At any cost, you should not tell anything to any third person, even if it is his own spouse, his own wife. Okay, so we always need to maintain confidentiality of the patient information, unless and until if the patient given permission. For example, a patient is in the ICU and he may tell, yes, please tell to my family that I have this problem. If the patient given permission, then only we should discuss about his confidential data. If not, we should not tell his information to anyone. So this is all about confidentiality, students. Mm, so a quick revision of today's lecture. So today we discussed about a Hippocratic oath and the patients and confidentiality. So in Hippocratic oath, we summarized the Hippocratic oath in this. So Hippocratic oath is a oath that is taken by the healthcare professionals obeying to the law and honestly doing our medical practice. Summary of Hippocratic oath is: we need to respect our teachers, we need to pledge, we need to dedicate our whole life for the service of the patients, we need to keep our patient interest first, we need to give patient interest first priority rather than our priority, and we need to protect our patient from harm and injustice. We need to treat all our patients equally without any bias. We need to respect patient right to make decision. If patient don't want this particular treatment, we need to respect it. If he is saying he don't want any surgery, yes, we need to respect that, his decision. Saying he don't want surgery, so let it be like that. But never manhandle the patient, or uh, never be harsh with patient. We need to respect patient's right to make decisions, and we need to continue improve the care when always whenever we can possible. So we need to improve the care to the patient. We should not become too much intimate with the patient. We should, it is always better to prevent rather than cure to the disease to the patient. We need to protect the patient's confidentiality, and also we need to share our medical knowledge with the others. So these are the certain things that we need to follow in Hippocratic నేను వాట్సాప్లో అడిగా secret. So some of these things include respect to patient's privacy. Confidentiality promotes trust between physician and patient, and confidentiality heartens patient's attention. And we need to confidentiality encourages patient to share information, and prevention is better than cure. So that's it, students. And there are a few levels of breach of confidentiality. So there is patient details among the physicians. So trivial information second third person who is in medical profession, and a significant breach means we may discuss and there are a few exceptions. Right? So that's it, students. So this is all about Hippocratic oath and role of confidentiality in medical ethics class.
Hello. Hi. Hello. Good morning,
I will
sir.
share these notes in the group. Okay.
Hello.
Yes. Good morning, student.
Sir, I want to know about the offline
Can
classes
you?
schedule today, sir. I came to
Yes.
schedule. Sir, I want to know about the
Okay.
offline class schedule. So because I came to the college,
Hmm.
but my iCloud is not showing my timetable properly, and the internet is very
Okay.
low here. So I just want to ask you manually that
Yeah,
what
I
is the
already kept in the group. Send once again in the group. Okay. It is version 7 timetable. Now itself I'm keeping in the group. Manual timetable I'm keeping in the group.
sir today?
Okay.
Sir, what is today, sir? Sir, because I'm the sir.
Or in the second batch. See, either it is batch 1 or batch 2. Okay. The timetable is same for either offline or online. So offline people will come to university. Are you in the
So I'm in the
university now?
university campus, sir. Yes, sir. I'm in the
Who
campus.
is this? You're in
So
the
Aman,
then come 504. Huh? Okay, Aman.
sir, I didn't heard your voice,
So
sir. It's
are
low.
you you came to our classroom?
Sir, I can't hear you, sir. So okay,
Mm,
sir, I'll come to classroom, sir.
you please. Okay,
Sir,
okay.
what will
Come
be
to
lecture?
classroom. You need to come to classroom, and the time will be according to the timetable. I just shared timetable in the group. Go through it.
Okay, sir. Okay, sir. Okay, sir.
Now you in the morning
Thank you,
session.
sir.
Okay. Please visit here. Yeah, I
Okay,
will.
sir.
Okay.
Thank you, sir.
Yeah.